questions?
Yeah, I noticed that on one of your graphs that the males had a higher incidence rate. Is there any reasons for this?
With male incidences, there's been a lot of studies that have been done on stuff like that. Generally, the males always had a higher incidence rate, but a study came out and they tested it on really young children. They were infants, and there was no difference between the two. What carried more weight was whether or not they were nourished properly and stuff like that.
Okay, so what makes children, you mentioned, and the elderly more susceptible?
So with children and elderly, there's two contributing factors. With children, as I mentioned before, with the nutrition and stuff like that, malnourished children are generally far more susceptible to experiencing symptoms and stuff like that. Whereas with the elderly, because of the proton pump inhibitors and the balancing of pH within the stomach, it allows for the bacteria to move through the stomach and colonize in the gastrointestinal tract and then work its way through that. Generally with children, with very young children, their adaptive immune system hasn't really developed, and it seems as though with the elderly, in many cases, they're immunocompromised. So it makes them far more likely to be infected and experience some of the worst symptoms.
In your risk factors section, there was a picture that had the cats and dogs. How can pets contribute to human infection?
There was a study done with the transmission of Campylobacter from pets to owners, but it was primarily done through fecal contamination, and that seems to be the main method of transmission from animal to animal or animal to human. It's generally through fecal contamination.
Okay, and you mentioned the Walkerton incident. I recognize that name and think it's somewhat local to us. Can you give me a little bit more detail about what that was and what happened?
Yeah, the Walkerton incident, on the news and everything like that, they said it was salmonella. However, what they failed to mention was that it was primarily Campylobacter. Campylobacter jejuni as well as Campylobacter coli, which in many cases is far more traumatizing than salmonella. So in that case, it got into the water system, and it was concentrated towards the city of Walkerton. However, as water incidences are, they're very sporadic. So in this case, it was within the city. However, it was very sporadic. So I guess that's the only way that they could have found out. If it was through meat or anything like that, it would have been a lot more concentrated per population around maybe grocery stores or farms or something like that. So in this case, because it was so sporadic, it was a dead giveaway that it was from the water, and with the testing and stuff, that's what it was.
Great, thanks.